Think of people that they get a blood test or something that says they're pre-diabetic. And I'll use myself because actually I did a blood test not too long ago, and it suggested that my insulin and triglyceride levels were getting to the point where they were like, hey, you might be pre-diabetic. And I immediately was like, okay, I got to change something. I got to change right away. I know a lot of people don't think that will change, or it's not a big deal, or I know that happens a lot of times, which is why type 2 keeps rising. But
Yeah.
In that moment, how can tech-enabled health and monitoring systems, how can that help me? Because I can envision a way it would help, but I'd love to hear from your words. Like, what do you see? Because I immediately started changing the way I ate, but I don't, to your point, I don't actually know what was happening to myself inside until I went back for a blood test, a couple months later.
So if you take that scenario, right, and sort of play it out of like, how can tech help the healthcare delivery side of that? Because I do think this is always a partnership, right? You've got the healthcare side, the professionals, and you've got the patient. And so in that scenario where you get a, hemoglobin A1C, it's like the measure of average blood glucose. It's a way that we screen for pre-diabetes or type 2 diabetes. So that lab test comes back and indicates that you're at risk of, you're kind of inching up towards that threshold. So, imagine that IT system, sends you a notification of, hey, let's, a text message, right? A link. Let me explain to you your lab results, right? You click into that link, you get to watch a short video or something really compelling, 60 seconds, because none of us have an attention span for anything beyond that. And then you're offered, here are a couple of tech-enabled ways that we can help you make that change. Change is hard, right?
Mm-hmm.
Do you want to change your diet? Do you want to change your activity level? Here's a program for each of those, online coaching. If you get a wearable and it'll connect to this, and then a digital assistant will help give you encouragement and coach you through it. Here's a continuous glucose monitor. We're going to mail it to you. Do you want that? Yes, click. You get a continuous glucose monitor sent to your home. You wear it. It starts giving you insight to how is your body reacting to different foods you eat. Right? So there's all this stuff we can do on the consumer side, but we need to connect it back to the health system, to that lab test you had done. And then on the physician side, giving them the insight to, here's Albert, who had this lab test, who was offered these options, and kind of defining personas. Like, he's the guy who's taking the bull by the horns on this, right? He got a CGM. He signed up for coaching. They look at your next test and they're like, you're an activated, engaged consumer of your own health. I'm putting you in this low risk category. They get a notification on somebody else who had the same lab test as you, didn't engage with any of those options offered. They may put them in a higher risk stratification. We got to follow up on this person because they're not likely to make the change without our help, and they're likely to walk through the door a year from now and have progressed. So that's just kind of a hypothetical scenario there. But I think we're going to see that consumerization of healthcare, empowering all of us as consumers to take more control over our health. But we've got to have the connectivity to the provider. They've got to be our partner in that.
I, like most people, know what's good for me, right? I think most people know what's good for them, but I suffer from, I would say, what most people suffer from, which is I like eating good food, right? So that's in general the biggest problem I would say between, people with disease states and people without, is that they, for whatever reason, they can't separate that.
But we are all individuals. And so knowing that, sort of taking that generalization to how do things affect you as an individual and your physiology is a really important thing, because if you and I were to each wear one of those and eat all the same things and drink all the same things, our bodies would actually respond differently. And that's a really important education.
That's 100% correct. And so I think about how if someone was, let's say, like you said, a little bit more proactive and wanting to say, hey, I'm going to get this under control with myself. Constantly, constantly having, like, every time I eat, like I got some Brussels sprouts here with sriracha honey. I haven't finished it, but like that's all I got for lunch. I would want to see my blood sugar, like how does it react? And versus like if I eat a sandwich or drink a soda, and seeing those things. And I'm thinking about like, hey, if I had an alerting system that said, hey, you've crossed your blood sugar limits 3 out of the last 4 days or 4 days in a row. Like imagine getting those alerts. For myself, it's something that I think I would be very appreciative of, and I think I could change that. And then for those who maybe feel like they need some more support, I can 100% seeing like doctors being able to say like, hey, you've now, on top of my alerting system, right? On top of the alerting system, them giving me a call, or the nurse giving me a call and being like, hey, listen, buddy, what are you on a rager? Are you on vacation? Like, what are you doing?
Yeah. Yeah. And if they have the other context around your health, right? They know, what other health conditions that individual has. I don't know if you've talked on this show about social determinants of health, but sort of all of that, socioeconomic data that we know has a huge impact on health as well.
It's got a huge impact.
Yeah. And so they need systems that take into account all of that data and then sort of surface the insight to them. So here's this patient, who is at risk for type 2 diabetes, has these other comorbidities or, other diagnoses. And here's sort of their social determinants data based on, what kind of insurance do they have? Where do they live? What's their, demographic? Then you can really start to help them, dedicate the right resources to the right patients to sort of optimize the outcome.
Hey, thanks for watching. This segment is brought to us by Salesforce Platform. Visit salesforce.com/newsletter to discover timely insights and useful tips tailored to your role. Subscribe to this channel and get more great IT and tech interviews with top industry leaders.